McGovern for any remarks he wishes to make.
Well, thank you, Mr. Chairman. And let me be clear, the measures before us today are not good ideas. HJ Res 7, which terminates the COVID national emergency declared in 2020 by President Trump and renewed by President Biden, pretends that COVID isn't still a problem. HR 382, the Pandemic is Over Act, which repeals Health and Human Services public health emergency declarations related to COVID, says we should just go back to the way things were before the pandemic, restricting health care access and expanded health services for millions of people across this country. HR 139, the Show Up Act, pretends that technology does not exist and that telework is never a good idea. And HR 497, the Freedom for Healthcare Workers Act, pretends that science doesn't exist by removing COVID vaccination requirements for workers at the Centers for Medicare and Medicaid Services. And what's worse is not a single one of these bills has gone through committee. And this is the week where committees are being constituted, and if you waited a week, you could actually bring these bills through committee. And after all the rhetoric that we've heard from my friends on the other side of the aisle about regular order and the very first bills we're considering in this committee, unfortunately are not going through regular order. Not a single hearing, not a single amendment offered, no markups. Just Friday, Speaker McCarthy said, and I quote, "Look, I think anything we do goes through committee." Maybe he misspoke. I guess my question is, what happened? And it only gets worse when we actually look into the substance of these bills. We all know that COVID has moved into a new phase. Thanks to the use of safe, effective vaccines and other prevention tools, we're moving forward. We're learning to live with it. But let's not forget that over 1 million of our fellow Americans have died from it. And we should not ignore the fact that COVID continues to spread and mutate. It still poses a danger to people, including many immunocompromised people, including many of the people we serve with here in the House. Yet as we enter this new phase, these bills aren't about moving forward, they're about going backwards, pretending like COVID never happened, or that there's still not risks. It doesn't make any sense to me. Telework has allowed our nation and government to function through this historic pandemic. Studies have shown that telework has been largely beneficial, resulting in increased productivity, reduced absences, reduced turnover, and reduced office costs. That's not to say that in-person work isn't important, but if corporate America has come to accept and harness the net positive effects of teleworking, government agencies should too. Technology is not something to fear, or it's not a radical idea. I get the sense that sometimes my Republican friends think bifocals is a radical idea. I mean, times are changing. Technology has advanced. We should embrace it, not run away from it. Our side isn't afraid to embrace change. We know that living in the 21st century means we can and we should use technology to improve Americans' quality of life. We know that vaccines save lives and science is actually real. We know that ending these emergencies immediately without thoughtful discussion and deliberation is irresponsible. For example, ending the emergency would end the FDA's emergency use authorization for COVID tests, treatments for the disease, and other countermeasures that have saved countless lives around our country. And let me just say to my friends, I'm not just making these points to be a contrarian here, but there may be some unintended consequences to what you're doing here today, and totally bypassing any regular order or ending or bypassing any hearing may mean you may not find out what those unintended consequences are until after the fact. Look, we know that we are here to make progress, not to go back in time, which is what the 4 measures we are here to consider today would do. No one is suggesting that protocols shouldn't change. In fact, many things have already changed, as my colleagues well know. However, when it comes to protecting the American people, can't we at least be a little more responsible? Thank you, Mr. Chairman, and with that, I yield back my time.